Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. A simple, easy-to-construct air filter can protect against illness caused not only by viruses but also by chemical pollutants, according to a study. Study lead author Joseph Braun, an associate professor at Brown University in the US, said that the findings show that an inexpensive, easy-to-construct air filter can protect against illness caused not only by viruses but also by chemical pollutants. He also said that this type of highly accessible public health intervention can empower community groups to take steps to improve their air quality and therefore their health. Tamil Nadu is recently experiencing the war between private and government medical institutes after the State Health Department decided to send all the MD emergency medicine postgraduate students for training in corporate hospitals. Strongly opposing the move, already the Service Doctors and Postgraduate Association, that is SDPGA, and Tamil Nadu Government Doctors Association, that is TNGDA, have pointed out that the corporate hospitals lack the adequate infrastructure, including the availability of experienced facilities, which is available in the government institutes. The Delhi High Court has sought response of the Centre and the National Medical Commission on a medical aspirant's plea challenging the disability certificate issued by Lady Hardinge Medical College, which assessed his disability at 100%. According to the petitioner, he has 60% locomotor disability and the assessment of his disability to the extent of 100% is untenable, especially when the Disability Board has itself observed that the petitioner is not using any assistive devices. High Court said the counter affidavits shall be filed within 4 weeks and listed the petition for further hearing on Feb 27. New research from the University of Copenhagen suggests that a portion of the Danish population has a composition of gut microbes that, on average, extracts more energy from food than do the microbes in the guts of their fellow Danes. The research is a step towards understanding why some people gain more weight than others even when they eat the same. Unfair as it is, some of us seem to put on weight just by looking at a plate of Christmas cookies, while others can munch away with abandon and not gain a gram. Part of the explanation could be related to the composition of our gut microbes. This, according to new research conducted by University of Copenhagen's Department of Nutrition, Exercise and Sports. Researchers studied the residual energy in the faces of 85 Danes to estimate how effective their gut microbes are at extracting energy from food. At the same time, they mapped the composition of gut microbes for each participant. The results show that roughly 40% of the participants belong to a group that on average extracts more energy from food compared to the other 60%. Lung cancer is the deadliest cancer in the US and around the world. Many of the currently available therapies have been ineffective, leaving patients with a very few options. A promising new strategy to treat cancer has been bacterial therapy, but while this treatment modality has quickly progressed from lab experiments to clinical trials in the last 5 years, the most effective treatment for certain type of cancers may be in combination with other drugs. Columbia engineering researchers report that they have developed a preclinical evaluation pipeline for characterization of bacterial therapies in lung cancer models. Their new study, published December 13 by Scientific Reports, combines bacterial therapies with other modalities of treatment to improve treatment efficacy without any additional toxicity. This new approach was able to rapidly characterize bacterial therapies and successfully integrate them with current targeted therapies for lung cancer. New research from the University of Virginia School of Medicine speaks to the benefits of a COVID-19 booster. The new findings shed light on how mRNA boosters, both Pfizer and Moderna, affect the durability of our antibodies to COVID-19. A booster, the researchers report, made for longer-lasting antibodies for all recipients, even those who have recovered from a COVID-19 infection. The research team looked at antibody levels following a booster in 117 UVA employee volunteers and compared those results with the levels seen in 228 volunteers after their primary vaccination series. Antibody levels 1 week to 31 days after the primary series and booster were similar, but the boosted antibodies stuck around longer regardless of whether the person have had COVID-19. A perplexing range of neurodegenerative diseases is known to attack distinct regions of the brain, causing severe cognitive and motor deficits. New insights suggest many of these afflictions have their origin in a constellation of common processes which play out in different ways as each disease develops. In a study, the authors look at cellular alterations in 6 distinct neurodegenerative diseases, that is amyotrophic lateral sclerosis or Lou Gehrig's disease, Alzheimer's disease, Friedreich's ataxia, frontotemporal dementia, Huntington's disease, and Parkinson's disease. Tobacco use could have an adverse effect on their fetus and infants as well as the pregnant females themselves, finds a recent study published in the Curious Journal of Medical Science. Tobacco use was found to be responsible for numerous adverse pregnancy outcomes for females and their infants. Smoking during pregnancy, whether actively or passively, increases the chances of spontaneous abortion, placenta previa, and placental abruption. Additionally, smoking cigarettes that contain tobacco increases the risk of premature membrane rupture, placenta previa, and preterm delivery. This cross-sectional study conducted by Nagaria T. et al. Tried to explore the adverse outcome of tobacco use among pregnant females. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.